Hey, we've made it. It's Wednesday Night Live at Siskiyou Vita Medicine. I'm Dr. Duncan. This is Ron Veitel.
Hello.
And we are joining you from beautiful Medford, Oregon. And we're a direct care practice here in Southern Oregon. And we love what we do. And this is Wednesday Night Live, where we come to you almost every Wednesday night and have a really cool discussion around just common health topics. Things you might see in the news, in the media. We might talk about things you hear from your friends or some things you hear from your physician. If you have any health topics, any health concerns that you want to talk about, please put something down in the description in our Facebook page, or you can email us at admin@siskiyouvitamedicine.com. Last week we talked about supplements and the quality of supplements, and we had a lot of feedback on our Facebook page asking for part 2. So we decided let's talk about supplements again. Part 2. But before we get into that, I just want to say that we have a lot going on here at Siskiyou Vita Medicine. We have a lot to offer. Ron is our nutrition and lifestyle coach. He's been in the nutrition industry for almost, 2 decades, over 2 decades. So
2 decades, hard to believe.
He has a lot of information to share with all of you. We have a naturopathic practice here. We just had Dr. Carrie Neal Straub join us, and she's going to be practicing here out of Siskiyou Vita Medicine, and we're excited to help her build her practice. We have Pat Dykes here, who's doing reflexology. We also have Dr. Casey Frieder, who's coming in and doing the natural skin clinic. And we also have Dr. Wyman, who's a chiropractor doing sports chiropractic. And then finally, we have Summer Waters, who's an acupuncturist. And she is seeing people for acupuncture, Chinese medicine, as well as GAPS nutrition. If you guys know anybody out there struggling to heal their gut, or know any children dealing with autism, this is the diet that you want to look into. It was developed by a neurologist who was looking at treating the gut for autistic children, and GAPS stands for gut and psychology syndrome. So it's useful. It really helps reset the detox pathways as well as the microbiome in the intestines. So it can be very effective for a host of conditions, health conditions. Ron is continuing on with the Life Mastery series, and we'll have more information on that coming up. We have a class going on now. When does the next class start?
So the next class starts the first Monday in February, and right this month, the month of January, we're doing the sensory systems, and next month we're doing heart health. So we're taking a body, mind, spirit approach into the heart, combining physiology with yoga, with Kundalini yoga, and we're going to explore the domain of the heart for the month of February, which is really exciting.
That's fascinating.
Yes.
Yeah, that's cool.
So, and one more thing.
Yes.
We do have Maria Lapuma, who is a modern stress, energy practitioner. She deals a lot with stress management, stress reduction techniques, and she does a every other week healing group here at the clinic. So next Thursday, not tomorrow, but the following, January 25th, is the next healing circle, and it's definitely worth being a part of. She has one down in Ashland. She's cultivating one here, and I think it's a really great way to get some great techniques to help with handling and managing stress, and also a really wonderful way to just take an hour and a half and do some stress decompression.
Yeah, decompression.
Mm-hmm.
I was speaking with a patient today who is dealing with ulcerative colitis, and a lot of times what we find with a condition like ulcerative colitis or even IBS or IBD, that stress plays a major role.
Yes.
So she talked about how she thought she had it under control until she had a stressful event in her life, and then symptoms came back with a vengeance. So whether you're dealing with a severe health condition, or you're just finding that you're a little run down and not recovering from illness as quickly as you used to, or you're just not excited about what you're doing in the moment, take a minute and try to decompress. But I think Maria Lapuma's class is going to be something that could be invaluable to you and give you those tools like you talked about,
Yeah.
to then deal with the stressors in your life.
I think it's crucial. I love the work that she does, and I think it's fundamental to any health program because stress is the silent killer. I think if you look at the effects of stress, it's basically involved with every chronic degenerative disease you can think of.
Right.
So once you have elevated cortisol, that can throw the entire physiology out of whack. So
right, and it really affects the biome. It really affects your microbiome in your gut. And we're learning more and more about the biome and how it plays a role in neurotransmitter production as well as stress hormone release and metabolism. So, decompressing, reducing the stress in your life is key.
Yes.
And I'm super happy to have her.
Yeah.
And I'm super happy to have the clinic because we have so many services that are being offered that can help you manage and reduce your stress. It's all about stress reduction. Okay, so maybe it's time to jump into our topic a little bit. Yeah. So do you want to lead us off with that?
I will. So I've been, as Dr. Duncan said, I've been in nutrition for 20 years, almost even a little more than that, really. I first started in the supplement industry, first started taking supplements when I was 21, so it's been 24.
You were an early adapter.
I was an early adopter of nutritional products. So that's been 24 years. So as a nutritionist, one of the main questions that I get is, I'm relatively healthy, but I know I should be taking something. What is a good foundational supplement regime? And so that is a question that I field all the time. Everyone wants to know, what are the top 5 or 6 products that I could take to cover my bases and continue with the quality of health that I have right now. So that's what we're going to dive into today. We're going to dive into what is a good foundational supplement program.
Right. It's kind of tricky to talk about something that you would say is constant across the board for everybody. And I get a lot of folks that come in saying they take a multivitamin, and I ask them, what is it that you're taking? And what's inside of it, what is it comprised of? And a lot of people can't answer that question, and we just take for granted, it's a multi, I'm supposed to take vitamins, I'm getting something from Costco, or I'm getting something from Walmart or GNC to that effect. And a lot of times, I think we touched on this last time a little bit about especially B vitamin metabolism. It's really important to know what you're taking and why you're taking it. And so I also get the question, what do you recommend as a multivitamin? And for the healthy individual that is really looking for optimal wellness, and they're not dealing with an endocrine dysfunction, whether it be a thyroid or a blood sugar issue or hormone imbalances, I have a couple of go-tos. And in my cabinet, let's just start with one. I have a probiotic in my refrigerator, and it doesn't need to be refrigerated. I just have a habit of putting my probiotics in the refrigerator, so that's where it's living at the moment. But a probiotic is definitely something that I recommend across the board for most people.
I do as well.
Yeah,
I love probiotics. I think when we look at the research coming out on the importance of the microbiome and how it affects pretty much all of our core physiological functions for the most part, I find that taking a probiotic is one of the foundational things. And like you said, it's hard to say what everyone needs across the board because we're all unique, we're all individuals. But I think a probiotic is one thing that pretty much everybody could be taking. We have drip antibiotics in our water supply. We have drip antibiotics in our food supply. So our microbiome is being assaulted by a lot of things, not just the antibiotics, but also commercial soaps and things like that will affect our bacterial compilation. And the reality is that we have a whole lot more bacterial genes than we do human genes. We have about 23,000 human genes, but when you look at our microbiome, we have about 9 million bacterial genes. We are considerably more microbial than we are human. So we want to care for them.
That's incredible, right? That's an astounding number of microbes and the microbe DNA that's within us. And we touched on this a little bit in the beginning, the introduction, in that stress really can play a role in how the gut is populated and what sort of bacteria are populating the gut.
Right.
So I think it's always a really, a decent or a good idea to be supplementing with the probiotic, especially coming into the season that we're in, like the flu season.
Right.
The food choices out there are sometimes lackluster, if not just downright poisonous. So it's super important that you continually repopulate the gut and take care of your gut. So, that's kind of the interface with our outer world, right? It's where our nutrition comes from. So it's super important that you're on a good quality probiotic. And I happen to take a probiotic that doesn't need refrigeration.
Yeah, me too.
Yeah,
take one
shelf stable.
Shelf stable. There's some really great shelf stable ones out there. In a probiotic, it's not just about the microbiome either. It's going to help enhance your capacity or your capability to digest your food. It's going to boost immune function. It's going to help keep you regular. There's a lot of benefits that come from a probiotic. So I think a probiotic
is up there.
All and right. I want to touch on, you had mentioned a multi, and multis are really crucial. And as we go through this, I guess this could have been put at the top here, is that this is not an insurance policy to eat crappy food.
Right.
This is to enhance your lifestyle and your health practice.
Right.
Right. So these don't mean that you can go and eat McDonald's and things like that. This means eat a healthy diet, and that's what a supplement is designed for. A dietary supplement, it supplements the diet. It's not an insurance policy for the diet. So.
Right. So the other thing that we mentioned before we went live is that while we do recommend some base supplements, I would call these foundational supplements, dietary supplements, there's nothing that can replace a healthy diet. Right. If you're eating lots of vegetables, healthy fats, proteins, and whole grains occasionally, then there's no reason you should not be getting the nutrients that you need, especially if you're growing your own food in healthy soils, or you're supporting a local farmer that's growing in healthy soils, and searching for those organic sources.
Right.
Then most of your nutrition needs are met. Unfortunately, with the agricultural system that we have, a lot of the nutrients in our foods are just being depleted or just farmed out.
The soil doesn't have it like it used to. Our soil is losing its mineral status for the most part. So foods are becoming weaker in their amount of minerals due to that.
And one in particular, magnesium.
Yeah.
Right. So a lot of magnesium is being depleted out of our food system. And so one of my foundational supplements is actually magnesium. I think it's super helpful for the cardiovascular system. It's great for the musculoskeletal system. It helps with nerve conduction, it helps with detox pathways. It helps your immune system fight infection. So there's just so many things that we depend on in terms of magnesium that I think it's worthwhile supplementing. And I've noticed an improvement in just my recovery time from exercise by utilizing magnesium. And when I was going to school at Bastyr, I had a professor, a medical doctor who had been in practice, I think 40 years, just a wealth of knowledge. This guy was just an amazing practitioner. And he was telling us about how every patient of his that had a heart attack and that he would hospitalize, he ensured that while in the hospital and while receiving IV fluids, that there was always magnesium in there. And the reason is that all of his patients that were on magnesium recovered from that heart attack much quicker than those who were not, and it also reduced the amount of recurrent heart attacks in his population. So to me, that was sort of it was impactful.
Yeah.
Thinking about the cardiovascular system, and it's super simple to take. It's not a supplement that's super expensive. You can find a good source of magnesium right here at our clinic.
Absolutely. And here's the thing: if you go out into getting it here at the clinic is fantastic because we can, we have a limited selection. If you go to a health food store, you're going to see 15 different types of magnesium. You're going to see magnesium threonate, magnesium malate, magnesium citrate, glycinate. There's all these different forms of magnesium. So many of them make your eyes glaze over. But they all do different things in the body. So when you take a magnesium, you want to know why you're taking it, and that's going to lead you to the proper form. So.
Yes, right. And if you have questions about that, we can get very specific. So, before you rush off to your supplement store, make sure that you understand what type of magnesium you're taking. Because some people will take magnesium and say, man, it didn't do anything. It didn't touch the muscle aches I was having, but sure gave me the runs. Right?
Yes.
Sure loosened my bowels.
Right.
Well, there's a reason for that.
Yep.
And so it's important to know, just like you were saying.
Yeah.
All right, so what's one of your favorite foundational supplements?
My
all-time favorite.
All-time favorite. You know exactly where I'm going to go.
Yes,
you know exactly where I'm going with that. And maybe some of you do who know me will. My favorite foundational supplement is digestive bitters. I absolutely love digestive bitters for a variety of reasons. Everyone that I deal with has some sort of digestive issue, has some sort of difficulty digesting their food in one way or another. And digestive bitters are a fantastic way to stimulate your digestive forces. When you take bitters and that bitter taste touches the tongue, it stimulates the stomach to start secreting hydrochloric acid, the pancreas to start releasing pancreatic juices full of enzymes, as well as the gallbladder for bile secretion. But another thing that it does is it gives the liver a little nudge. A little like, hey, you got some work to do here. Don't be so sluggish. And so it challenges the liver, it gets the liver detoxing, and it also helps balance blood sugar levels. And it supports immune function as well. So digestive bitters, they support immune function, they help balance blood sugar levels, stimulate detoxification processes, and help with digestion, all in one.
It's like a pretty little package.
It is.
Yeah. What are your favorite bitters? So do you have like herbs that you tend to use a lot more than others?
I do.
What are your favorites?
So I love Oregon grape. Oregon grape is a favorite of mine because it has multiple uses. I love yarrow. I love wormwood, even though it's a little strong, but just a little bit of that wormwood is really fantastic bitter. I like burdock root, as well as a little bit of ginger, a little heat. So those are some of my favorites there.
Yeah, some of my favorites are dandelion. I like gentian. It's a pretty powerful bitter, but a strong one. Just a little bit, just a little nudge.
Yeah,
really helps with getting those digestive forces that you talked about going. I also like ginger, and then there's something called Cyanara scoliomus or artichoke.
Yes,
right.
Yes,
one of my faves. So if you're dealing with detox issues, or you have, like Ron was saying, any digestive complaints, one of the best places to start is with the digestive bitter.
Yeah,
it's super easy. You can use it before meals, and I want to stress that when I give the recommendation for a digestive bitter, whether it be the herbs that we talked about or the apple cider vinegar or something else that's stimulating, it's not about the herb actually getting into the stomach as much as it is the taste. So it's super important that you guys are tasting your bitters. And, I know they're bitter and they don't taste good, but that's by design. That's to stimulate the vagus nerve and to stimulate those digestive forces that Ron mentioned, and to get them going. And so I was talking to a gentleman yesterday, it was this morning, and he asked me, can I do the bitters in a capsule? Can I because they're so disgusting, can I put my bitters in a capsule? I said, no, you can't do that. I said, I had a 20-minute conversation about how the bitter is the medicine. The taste is in the medicine is in the taste. And he totally blew that off and forgot that and was like putting stuff in capsules. So we had to have that conversation again. So I just wanted to reiterate that bitterness in those herbs, or the sourness in the apple cider vinegar, that's the medicine.
Yeah. And just it's really, and you'll get used to the flavor of it. And then at least for me, in my experience, at first it was really strong and harsh, but the more consistent I was, I started to appreciate the flavor. I looked forward to it. And I gave some to a patient I guess last week sometime, and I got an email from him about 3-4 days later, said, all my digestive complaints have stopped since starting that. So
start there. Foundations, man.
It's amazing.
Yeah. Get that digestive tract prepared for that food. Mm-hmm. All right, so next, this is a big topic here in the Northwest because of our position away from the sun, right? We're at a higher latitude, and this has to do with vitamin D levels. So in the winter times, we are in the dark time of the year. We're producing a lot less vitamin D. So one of the things that I supplement with personally and that I recommend for most of us Northwesties is to take at least 5,000 IUs of vitamin D a day. And now, if you're someone who has calcium issues or issues with your conduction system, meaning nervous system, like if you're an AFib or any heart issues or any muscle spasms, then consult with a physician before starting a vitamin D regimen so that you can check your vitamin D levels as well as your calcium levels, because vitamin D is going to increase your calcium absorption. One of the supplements that I do not recommend is calcium, because we have a lot of calcium in our food, and if you're taking the appropriate amounts of vitamin D, then you're going to be absorbing enough calcium from your food. The other component that I like to add with that vitamin D, and we have a product that sort of combines both of these, is K2. And K2's job in complement in this with vitamin D and calcium is that it directs the calcium out of the bloodstream and into the bones and the tissues that need calcium. So it really reduces your risk of building up plaques in the arteries. So vitamin D levels in the Northwest, or with anybody, I try to get people to between 50 and 80 on their blood tests. And vitamin D helps with a slew of things. It helps with immune function, helps with steroid production or hormone production in the body. The bone health is super important. Skin health,
blood pressure,
right? I mean,
pain,
sleep, anxiety. I mean, there's a lot of things that vitamin D has to deal with. So vitamin D is definitely on my list of go-tos.
Yeah, fantastic.
Yep.
Should be another one at the top there.
Yep.
All right.
What's more? What do we have?
We got another one here. Omega-3 fatty acids. Really crucial. Okay, so all of our cells have a lipid bilayer. That means 2 layers of fat. And that fat is comprised of a variety of fats, such as saturated, omega-3s, omega-6s. And our body, the human physiology, likes a ratio of about 3.5 to 1 of omega-6 to omega-3. Our body likes a little more omega-6 than omega-3. And the reality is that this day and age is that because of the foods we're eating, our omega-6 fatty acid profile is considerably higher than it should be. I've read statistics that say 20 to 1, upwards of 50 to 1, omega-6 to omega-3. So there's a real disproportion between the 6s and 3s in the physiology. So we need to get those 3s up because they're anti-inflammatory, they're great for the cardiovascular system, great for the brain. They serve so many important physiological roles. It takes fat to burn fat. If you can get your caloric, if you can make fatty acids, omega-3 fatty acids, and other essential fatty acids about 12 to 15% of your calories, you'll find that that will stimulate the fat burning process. It takes fat to burn fat. So there's a variety of omega-3s that you can choose from. There's flax oil, there's fish oils, there's chia seed, there's all sorts of things that you can use. Here's the deal though, it's a little tricky. Our cell membranes like a balance. They're like a balance of omega-3, 6, and 9. And if you were just to take flaxseed oil as an example, which is a primary omega-3, and it's got something in it called alpha-linolenic acid, and if you just took flax oil all the time for several months, what will begin to happen is you'll get a buildup of that in the cell membrane, and it starts to block other fats from getting into the membrane, like EPA and DHA from fish oils, and other important fats. So you want to make sure that you're rotating your fats around, or getting one that is nicely balanced with omega-3, 6, and 9. But fish oil, cod liver oil, flaxseed oil, hemp seed oil. These are all fantastic oils for omega-3s.
Perfect. I like cod liver oil, and I like to get just, our bodies make EPA and DHA out of omega-3s. So, I like to do the parent molecule, and there's some argument for that and some argument against that. But, I'm sort of a generalist, right?
Right.
Okay.
Yeah.
What else do we have on the list? We're about out of time.
I think we covered it, right? The multi, we got
we got it.
Well, there's one last thing I do want to say about the EPA and DHA,
Right,
about our body being able to manufacture it from like alpha-linolenic acid.
Yes.
That is, it's an energy-consuming process that requires specific nutrients for that enzymatic reaction to take place. So if you are pregnant and you want to boost your DHA levels, this is the one time I would say you want to make sure you get DHA and don't rely on flax oil converting.
So we can get very, you can get into the details, right?
Yes.
So what we're talking about is basically a general.
Yes.
We're not talking about pregnant people or people with lipid disorders or liver dysfunction. So in general. Yeah.
Yes.
We were like, what are your favorite supplements, Ron?
Yes.
We have a list, Yeah. And we picked out the ones that are common with us.
Yeah.
I try to take I think less is more a lot of the times. And I try to get my nutrients from food.
Yep.
But, during this flu season, I've seen so many people with the flu, and I'm trying to keep myself healthy. So when it comes time to supplement vitamin D, cod liver oil, the reason I like cod liver oil is it has the vitamin A component to it.
Yeah.
Magnesium, bitters I absolutely love, a good probiotic, and then like a green drink or something. It's really difficult to get 9 to 12 servings of vegetables at times.
Right.
So if you have a nice green powder, I think there's a few products out there. I know that we carry one. There's one from Purium, if you guys are familiar with the Purium products. But even just getting the juicer out, or the Magic Bullet, or what is that one that's really amazing one?
The Vitamix?
The Vitamix, throw some veggies in there.
Or the
whip it
Ninja.
up.
There's the Ninja.
Get your veggies.
Yes. Absolutely.
Yeah.
So here's the deal. Supplements are great, and they're just that. They're supplements. The human physiology is designed to get its nutrition from food. And the supplements are there to help us achieve the level of optimal health we're really looking for. And so they're not an insurance policy. They're not you can take your supplements and go have, the standard American diet and be all good and healthy. We just want to make sure that you know that there are some foundational supplements to take to enhance your current
health
state of health and
wellness.
Awesome diet that you're following. Because I know all of you are really interested in having a healthy diet.
You guys are eating organic and local, right? Fermented foods, lots of veggies, healtty fats.
That's right.
A little bit of protein.
That's right. Some good protein. Deck of cards, palm thickness, not the fingers, just the palm.
Yep. Perfect.
Yes.
All right. Well, I think that wraps it up for this week. I really enjoyed this discussion tonight, and we'll be doing this again next Wednesday night. So if you guys like what you're hearing, give us a thumbs up, like our page.
Yes.
Visit
Share
our website. Yeah, share the video.
Share the videos. All the videos go to YouTube. Go to Siskiyou Vital Medicine on YouTube. They're all there. You can share them with your friends.
Yeah, it'd be great. All right, guys. Have a great evening. Stay warm, and we will see you next week.
Good night.
Cheers.